Hey, psych care pros! Ever felt like you were walking on eggshells with a patient who's deeply connected one moment and angrily withdrawn the next? You may be caring for someone with borderline personality disorder, or BPD, a complex and often misunderstood condition marked by intense emotional pain and unstable relationships. Let's talk about the root causes, key symptoms, and how nurses can provide consistent, compassionate care in what can be an emotionally charged environment. Borderline personality disorder is a mental health condition characterized by emotional dysregulation, unstable self-image, intense relationships, and impulsive behaviors. Core features include frantic efforts to avoid abandonment, whether real or perceived, a pattern of intense, unstable relationships, identity disturbance, impulsivity like substance use, unsafe sex, or binge eating, recurrent self-harm or suicidal behavior, chronic feelings of emptiness, intense anger or difficulty controlling anger, and stress-related paranoia or dissociation. Diagnosis requires 5 or more of these symptoms, beginning by early adulthood. So what causes BPD? Well, the biopsychosocial model helps us understand it. Biologically, there might be serotonin dysfunction and a heightened amygdala response. Psychologically, there's poor emotional regulation and low distress tolerance. Socially, early trauma, abuse, neglect, or invalidating environments can play a big role. There are also high rates of co-occurring disorders, including depression, PTSD, anxiety, and eating disorders. So let's talk about treatment options for borderline personality disorder. There really isn't a single medication that treats BPD itself, but medications can help target specific symptoms. For example, SSRIs and SNRIs are often used for mood instability, depression, or anxiety. Mood stabilizers like lamotrigine or valproate, though that one's off-label, may also be considered. And sometimes low-dose atypical antipsychotics, such as quetiapine or risperidone, are used for impulsivity or dissociation. But honestly, psychotherapy is the cornerstone of treatment. Dialectical Behavior Therapy, or DBT, is considered the gold standard. It teaches skills like mindfulness, distress tolerance, emotional regulation, and interpersonal effectiveness. There are also other therapies like schema-focused therapy, mentalization-based therapy, and cognitive behavioral therapy, or CBT. When it comes to nursing priorities, building a therapeutic alliance is absolutely key. It's important to be consistent, calm, and non-judgmental in your approach. Maintaining clear professional boundaries is a must. And to avoid splitting behavior, it's crucial that the whole care team stays consistent in their approach. When managing emotional crises, it's really important to monitor for any signs of self-harm or suicidal ideation. We need to use de-escalation techniques during emotional outbursts and honestly help patients practice grounding and coping skills as much as possible. Supporting skill building means we should reinforce those DBT principles, role-play assertive communication, and encourage journaling or creative expression too. We also need to educate family and caregivers. It's crucial to explain that behavior stems from emotional pain, not manipulation. Teach them how to respond without escalating the situation, and encourage participation in therapy or support groups whenever possible. The bottom line is, structure heals and empathy connects. BPD can challenge even the most seasoned caregivers, but behind all that, volatility is someone craving safety and connection. As nurses, we really bring the structure and empathy that can anchor them through those emotional storms. So, how do you stay grounded while supporting patients with BPD? Let us know your go-to strategies in the comments. And don't forget to like, subscribe, and follow for more psych nursing essentials. Because healing begins when trust is consistent.